Welcome to Adult Education. This is Sunday, May 31st, 2020, and we are continuing our adult education series, Working Differently in Different Times. Today we are talking to people in the healthcare industry. I'd like to introduce our panelists today. We have four of them here. The first is Doug McNeil, the professor of medicine at UW, a professor of medicine at UW. He sees patients with genitourinary cancers, but primarily does research, lab and clinical research focused on the development of tumor vaccines for treating prostate cancer. Doug, do you want to just say hi so we know who you are?
Hello.
Hey, Doug. Doug is also the organist at Covenant and is a very multifaceted and very talented man. So we give thanks for Doug here. The next person I'd like to introduce is Lisa Herman. Lisa is a staff chaplain at the UW Health Systems here in Madison with a focus on spiritual care and support in the American Family Children's Hospital. Lisa is a regular participant and worshiper at Covenant and I've been very glad that she's found her home here. She is an ordained minister of word and sacrament. She is a member of the John Knox Presbytery, Presbyterian minister, and a board certified chaplain. Lisa, do you want to say hi?
Hey everybody, good morning.
That's Lisa. Next up is Colleen Gullickson, who is the interim dean for the Henry Predlin School of Nursing, Business, and Health Sciences at Edgewood College. She's a nurse educator teaching undergraduate and graduate students in the nursing programs. Hello, Colleen.
Hello, everyone.
And then finally, Susan Hanauer, who is the manager of talent acquisition at UW Health. She's a seasoned nurse who has worked in a variety of nursing positions: inpatient, outpatient, bone marrow transplant coordinator, patient educator, lead consultant in quality management, clinic manager, nurse recruiter, and apparently hat juggler. Susan, do you want to say hey?
Hey.
And so that is our panel here today. I will encourage everybody, if you are on Zoom and not watching the recording, to go to speaker view at this point, so that way you'll be able to see who is talking as opposed to everybody sitting there with their listening faces on. So I'll give everybody a second to go to speaker view, and then I will ask the first question. And the first question is going to go to Colleen. And then after I ask Colleen, I will open the question up to the rest of the panel. So Colleen, what do you want people to know about your work during the pandemic?
Well, I gave this some thought this morning to try and make sense of it myself. So thank you for the opportunity to help get my thoughts focused. And I think one important thing overall, my work during the pandemic focused on ensuring continuity for our students and faculty. Allaying anxieties was huge. This came on right as spring break started, so people didn't really know, are we coming back? Are we not coming back? It's important to establish calm during chaos. And I think one of the biggest challenges was at that time when things first started happening, there was so much uncertainty and things were changing daily. And people wanted a plan, and there wasn't always a plan, or the plan that was devised at 8 in the morning was different by 12 noon. So it was a huge challenge for me to try and figure out how to support people, cope with anxieties. I had faculty that wanted to know, are we coming back? Are we not coming back? Are we going online? I had family members calling me, how can you put my daughter or son in these challenging times right in the heart of all this? You're putting them in life and death situations. And so it was a really challenging time to try and get a handle on things that were changing so quickly. Fortunately, things found a way to work out, as they always do. And once we had a little more understanding of what was happening locally and nationally, we were able to come up with a plan. But I would say that the first good month was a real challenge. We did ultimately transform everything into online learning, which was a whole new, many of the faculty in nursing, we have about 250 undergrads and about 120 graduate students that were all really in an uproar. So we went all online, which was good, but the other challenge is, how do you teach clinical education online? And the faculty I'm very proud. They did a great job. So my work was a lot of establishing calm during chaos for all the students and the 50 faculty. Okay.
Thank you very much. Anyone else on the panel care to share?
I mean, one thing that I would say from the UW Health perspective is, initially when we're all learning of this pandemic, I mean, it was shifting. How do we get staff to answer all these questions for people who are calling in and don't know, and get them onboarded quickly, get them working? One thing that we did actually was send a letter out to nurses that had retired in the past 5 years, because we knew we could probably get them onboarded and hired very quickly. And it was really wonderful to see all these people who had retired volunteering to coming back to help field all the questions in the community and that patients have. So I would echo what Colleen says too. It was changing day by day. It's great to see how everyone was able to come together and people really wanted to help. We had people just reaching out, calling, how can we help?
And I would say too, personally, being a nurse for as long as I have, my first reaction was not to run away from this, but we have to have our students be part of this experience, and we have to have people helping in whatever way they could. And the intent was not that our nursing students are going to go take care of the COVID patients, but there are other patients in the facility that still need care. And we have an obligation as professionals to not turn our back and run the other way, but to go into it as opposed to run away from it. And that was not the opinion of everyone. There was a lot of ethical dilemmas. A lot of the students didn't feel that they should be put in harm's way. And the sentiment was, yeah, I'll do that once I'm a nurse, but I'm just a student now, so I'm not ready for it. And so there was a lot of ethical dilemmas that had to be addressed.
I would agree. I think that there was a lot of change right at the very beginning, and a lot of upset. As a provider and seeing patients with cancer, we can't just stop. So we can't send everybody home and say, well, your annual physical, we're just going to put off for 6 months. These are people getting treatment. They have to continue to get treatment. And we were left with a mandate of, well, we have to keep treating patients, but you also can't see them, or we need to minimize contact and minimize the amount of contact that people have coming into the hospital. And so I think that that was a challenge right up front to kind of guide patients through this, and then try to come up with health systems that'll be able to deliver this kind of care. So we've obviously moved to a lot of telemedicine. I think that'll come up in some of these future questions, but I think this has been a good thing actually overall.
Thank you. So the next question I'm going to ask to Lisa. How has your job been affected?
Sure. Thanks for asking me to be a part of this, Jeff. I want to echo some of the things that Susan and Nancy and Doug already said. And number one is, since about mid-March, my job has changed and been affected every day. And it was kind of like strap in, hold on, and just wait for information. And every day, my staff, my colleagues, the chaplain staff, we met every day. And I would say for a good month, every day there was either a new schedule or a new change or something like that. The first thing I just want to remind folks of is, if you don't know what a hospital chaplain does and what makes me different from Jeff and Sue and Charlie, is if Jeff, Sue, or Charlie show up, I'm going to step back and let them offer pastoral care, whether it's in the hospital or out. And we always yield to the local clergy person. But as you all know, this COVID-19 crisis, one of the changes was we had to ask our local spiritual leaders to not come to the hospital. And many folks were left seemingly alone or not visited by their personal spiritual leader. So my staff and I, we had to stand in that gap. And that's one of the changes, is I didn't have those people to yield to. But overall, the biggest effects to my job, again, changing day by day. And I'm glad of this title, working differently in different times, because that's been exactly what we've been doing. So around March 25th, the folks that I report to made the difficult decision to consider chaplains non-essential. And along with roughly 1,200 to 1,600 other employees at UW Health, we were sent home to work remotely. I'm sitting at a desk on my personal computer, but I also have next to me, I feel well equipped. I have a laptop computer that's encrypted. I have access to everything that I have access to on my desktop at work, as though I was sitting in my office. But as a part of the COVID response and restrictions, especially as UW Health planned for that initial surge of patients, when they thought that Madison may very well end up like New York or Italy, they focused on the frontline workers and making sure to conserve and preserve PPE. So they tried to limit staff traffic on the floors to just the essential folks that needed to be there. So all spiritual care at UW Health, we were all sent home to work remotely. So I use a headset, and I can talk to you via telephone, which is a secure encrypted line, or we have this really neat thing. It's called Video. It's like secure FaceTime. Doug mentioned it. So basically, we have transformed ourselves to doing telemedicine or telechaplaincy. It's taken a lot of things to get used to. But I always describe what I've gone through, or the changes and effects on what I do. It's gone from, it's hit or miss for me. There are some really powerful new ways of being and ministering with people that I've learned, but also some pretty big frustrations. We went to, I'll just be blunt there, in order to rebound or be resilient, our organization has had to avoid layoffs. We've had to do some furloughs and forced vacations and things like that to make up for not having the big of surge and things. And they suspended our night chaplain program temporarily as a part of that. And so now 6 staff chaplains are doing the work of 12 people. I no longer know what a weekend is. A Wednesday is no different from a Saturday. My schedule is 2 days on, 1 day off, which on some ways is really awesome. Other days, not so much. But yeah, so those are the biggest physical changes and how we do things. What it forced me to do was step back and think, okay, how can I do a really good job or do things differently with a headset and with somebody carrying me into a room on an iPad, like a floating virtual presence. So I found some humor in it, a little virtual chaplain humor. But one of the things I learned was from our adult palliative care doctor, Toby Campbell. And he said, with telemedicine, the number one thing you have to do is, with the person you're talking to, is name the awkwardness and move on. So what I started doing was telling folks, I want to name that this is really awkward, that I would rather bust into your room and say, hey, how you doing? And they said, yeah, I'd like that too. And but they were also very receptive, very thankful that they still had someone. And I said to them, we are still connected as 2 human beings. And I believe that the divine, the holy, is connecting me from over here on Todd Drive to you over at Highland Avenue, still in many ways. And we're connected through our heart and through our love for one another. So, you know, one of the things that I thought about, Jeff, and talked about changing is I've always relied on, and my colleagues and I have talked about this, is physical presence. Folks were talking about, do we run away from this or do we run head on into it? And I believe that the folks at UW Health ran head on into it, and we prepared as best we could, and we rolled with the punches for many days, and we continue to do that. There are people whose education and experience far exceeds mine, but they also turn to me and ask me questions and opinions, and then they take it back and they sit down and they look at it and think about good science, what's good for humanity, and then they direct us and we follow. But one of the things that chaplains have always relied on, and at least I have, is that my medicine, instead of giving you a pill or a shot, is connection and physical presence. But when I can no longer use physical presence to see visual cues about how you're feeling or what you're doing or what your reaction is to me, I find myself listening in new ways. I have to use verbal cues to know if you're tearful or you're crying or you're upset. So these little beauties that are attached to my head have been working overtime while my eyes have been able to take a little bit of a break. So both appreciation and learning. So I give thanks to God for that, for the ability to step back and transform. And I give thanks that UW Health has equipped me with secure apps, headsets, encrypted computers, and access to everything that I have when I'm sitting in my office. The only thing is that I really horribly miss and is walking the halls and talking with people, because most of you know I'm just a little bit of a people person, maybe. And so the last thing I would say is this, is one of the things that I really had to struggle with about change was people talked about chaplains as heroes on TV, on news articles, things like that. And sitting at a desk with a headset on, I didn't feel like a hero. And I've had to do a lot of prayerful discernment about that, and come to my own conclusions about how I feel in all of this. So, and yeah, thank you.
Thank you very much, Lisa. I'm going to go to the next question, and I'm going to ask Susan, how has your faith come into play through this?
Sure. Jeff, I'd say my faith is really a constant part of my life. And so, it's steady, and I believe that things will be okay. I believe that challenging times are a part of life, and that we're going to get through this. But I'd say the positive things that have reinforced my faith really is how everyone in my workplace have really come together to do what is best and put all that effort forward. And it's been hard because none of us have been through a pandemic before, and so there are a lot of processes that you may not even think about that need to be taken care of. But I guess it's very hopeful for me to see how much people care and how they really want to do things to help, and I will get through this, and that's what I believe. And so just the good in other people help restore my faith. So
thank you very much. Anyone else on the call care to share about how their faith has been part of their work through this?
Jeff, can I, this is Lisa, can I chime in there?
Yeah, please.
Yeah, sure. I thought about this one. I thought it was a neat question. A lot of people think, okay, you're a chaplain, so automatically your faith comes into play every day. There are times when I totally miss it and it doesn't, but the past 2 months has been definitely a time of seeking and reconnecting to God in different ways. And I ended my last statement with talking about not feeling like a hero. And that's where my faith has helped me, because they talk about not all heroes wear capes. And I still don't think of myself as superhuman or somebody, you know, rips open their shirt with a big C on it or anything like that. But I thought about and reflected on what I know and what I don't know about scriptures and history. But I feel like scriptures and human history are full of people that God has used and worked through, ordinary people like me, to accomplish extraordinary things, and especially in challenging times. So like they say with Mr. Rogers, look for the helpers. And that's what I've done, is I've looked at myself in the mirror and reminded myself, even though I'm using a headset and an iPad, I'm still a helper. I'm still a healer, and I'm still connecting to people. And God's still using me. And then I get to witness other people on the news, the internet, through you all, and then total strangers being used to accomplish extraordinary things in challenging times. I think about the Moses and the Rahab and the Mary Magdalene, the Martin Luther King. I watched that U.S. Grant miniseries on History Channel. And so this was how I felt pre-COVID. It was really rocked me and challenged me when all this happened. And I was able to reconnect with that part of my faith, and I try to remember it now. I also believe that God gave us science and those who practice it in very many different forms to combat the evils of illness and disease. And that's what I try to remind people every day, that the Holy is still present, even in the midst of COVID, and is working to help us work this jigsaw puzzle and to solve it.
Thank you.
Yeah.
Yeah, wonderful. Thank you, Lisa. And actually, this next question is coming right back to you.
Okay.
So what have you learned about your job that you didn't know before all of this?
Sure. I'm going to echo a little bit of what I said before. And again, that before my ministry and my work was based on walking the halls, being present with people. Every hospital that I've worked in, I've used a technique called see and being seen. I build relationships in the calm times so that when the hard stuff hits, they're not looking at my ID badge trying to figure out who are you and what are you going to do for us. They already know. They can grab me by the shirt tail and say, we need you right here. Or Lisa, come here, we need you. And so connection and presence, again, continue to be a part of my medicine, just in different ways. I spoke about the idea of listening. That's one of the things that pastors are trained to do, and usually comes to the surface, both in a crisis, but also when folks need it. And the things that I didn't know before is, again, the idea of listening with new ears, listening in new ways. I discovered or learned about my job is that now my ears are both my eyes and my ears. When you're on the telephone with someone, you're listening for what's being said and not being said. You're listening for the pauses and trying to match those, and using silence as a tool. When I'm in person with you, I use silence as a tool. I have my invisible chaplain tool bag that I carry with me. And those connection, presence, and silence are my tools. But I've had to use them in new ways. And I've had some really incredible things that have happened. I've watched pastors go back and forth on a Facebook site that I'm a part of about what to do here and there. And it's been kind of incredible to watch. And chaplains, we have the same thing. I'm a part of another group, and we've asked each other and we've relied on our colleagues. What would you do here or there? And I want to just wrap up my answer to this question and remind you that one thing that I learned about my job is that you can support people via phone, but only to an extent. To phone or video, but again, only to an extent. But there is still something about being physically present. And my story I wanted to tell you about was something I did because I knew it was good pastoral care. I didn't always know. I questioned whether it was good liturgical practice. But one of my memories coming out of this is going to be baptizing a child at his mother's request, who was waiting on a liver transplant via video. And you're probably saying, how'd you do that? Well, I was the words, I blessed the water, the father held the child, the nurse held the bowl of water, and they took me in on an iPad, and I even had to say, ooh, back up, I can't see anything. So we got it together. And mom touched the water and touched it on her son's head as I said the words baptizing him. And for her and for that dad in that moment, and for me, God was present and her son was welcomed into the household of God.
Thank you, Lisa. The next question I have is for Doug. So Doug, if you could go back in time, back, 11 weeks now, what advice would you have given yourself?
Well, the first thing that comes to mind, Jeff, is maybe take money out of the stock market and maybe load up on masks. But maybe more seriously, I think a couple of things. One, take advantage of the downtime. This is an opportunity for us to sort of slow down in our lives and to kind of refocus on some of the things that are more important. I think if I had to do it over again, there was a lot of confusion and upset right at the very beginning. But as Christians, we're called to, one of the nice things about this is this virus has been the great equalizer. I mean, nobody's too important. Nobody's too powerful to not get this. And that reminds us that we're all here together, and we're called as Christians to take care of the sick and the elderly. And those are our people that are most at risk. And I think if we had to do it over again, I think to be a little bit more intentional about it. I mean, we've been praying for our neighbors and the people alone at home, but to really do more about it. Linda, my wife's we're grateful every day that, if we have to be in a pandemic, I'm so lucky and grateful that we have each other, but a lot of people don't. And so I think she's been very calling her dad, who's now in an assisted living facility and can't get out, calling him daily, and also some older friends too who are in assisted living and are isolated. And I think it's very hard for some of these people. So I think if I had to do it over again, to be more intentional about those types of things every day, to try to do something like that for our neighbors.
Thank you, Doug. And how about the rest of you all? If you could talk to your 3-month younger self, what would you say? Okay, so the last question I have, I'm going to start with Colleen here, and then I'm going to open it up to question and answer. So start thinking of questions already. No, actually listen to the participants and then think of questions. So Colleen, so what are the positive things that you will take forward once things return to, and I'm not going to say normal, but rather equilibrium? What are some positive things you'll take from this when things find themselves in balance?
Well, I think as an organization and the group of people that I work with, the faculty and staff, I think as a group, now that we've become more accustomed to the new normal, that I think the faculty I work with have really got a sense of their own inner strength and who they are and who they can be. They have a sense of appreciating creativity, and we've all been able to acknowledge our courage. And that's been a real personal, for everybody to step back and acknowledge that. I think work-wise, a huge opportunity was educators kind of get stuck in what they do and how they do it. And I think the pandemic was a great opportunity that really threw us in the deep end of the pool, and not always feeling like we had our water wings or whatever. And it was outstanding to watch people come together and figure out how they're going to do their work online. And moving forward, for us, I think it's really changed our teaching model forever. I don't think we're going to go back to our old ways. I think we found the positive things in how do you teach part of clinical education online when you're not in a patient's room with the patient in front of you. We're doing that in a reasonable way. So I think it's changed how we educate, and it'll change that forever. And that's a good thing. It's sort of a phoenix out of the fire kind of story. Mm-hmm.
Thank you, Colleen.
Yeah.
Yeah, Doug, Susan, Lisa?
Sure, I would agree that I think the remote learning, but also remote patient care is going to change things. We're realizing now that, boy, there are a lot of times where we really don't need to have somebody come into the clinic. If they can just get labs and we can just go over that, or get tests done, or consulting on patients across the end of the state, we don't necessarily need to have patients come in to do that. So I think this will be a better way to practice medicine in the future. One thing that's really struck me is how many, all of our big scientific meetings have moved to virtual meetings. So actually right now I'm supposed to be in Chicago at a 20,000 clinical oncologists meet in Chicago every year. And it's all moved virtually. And for me to sit in front of a computer screen to watch scientific presentations for 3 days in a row, 10 hours a day, it's just not going to happen. And what one realizes that a lot of the purpose of these, or a lot of the benefit that I receive from this, is not sitting and listening to a lecture, but interacting with people. And it's the spontaneous interactions, it's getting together with colleagues, it's the networking that's so important. So I think actually appreciating that in our work, where we think a lot of it's just the science, but a lot of it's the human contact. And I think we'll have a greater appreciation for that in the future.
Mm-hmm. Yeah, Lord knows recorded conferences really just aren't the same thing.
Right. Many can be, though. I mean, we've had some that have moved, and I'm grateful for it, because boy, it's nice. Instead of going to a meeting that's 6 hours in a room with 20 other people for a grant review or something, I can be at home and I don't have to travel, and I can, have dinner at home and sleep in my own bed. It's nice. I mean, there are advantages.
Very true. Susan, Lisa, anything else that you'll take forward from this?
I do think that more of us are going to be working from home in non-clinical areas. So in recruitment, the recruiters can do a lot from home. Yeah, and I think even the organization is looking at, do they need as much real estate as they did previously if people can work effectively from home, in terms of strictly office buildings. So it'll be interesting going forward. I definitely miss, though, the human contact, and I think part of my communication too is that I so much go off of body language and what people say, and then I feel like in these meetings you talk over each other a little bit more. It's kind of like you can't read the cues as well, but I think it's a skill you can get better at, so working on it.
I agree, Susan. I really missed something that would take me 5 minutes to do, to walk down to the hall and ask somebody a question. Now I'm typing it out, and Lord knows, actually call somebody on the phone, but it's taken longer to do some of the work that would normally just get up and walk down the hall and talk to somebody. So I do miss that. But a positive thing about the note, look at how pollution has gone down. My word, look at how pollution has gone down. That's fantastic. So there are positive things. Mm-hmm.
I have been noticing a lot more typos in emails sent to me, and I take that as a very good thing, because it means that we're just adjusting to perfect. You don't need to draft the perfect email. So keep up the typos, everybody.
I feel like you just, Jeff, you just honor your sausage fingers, which I have, and everybody is okay with that when you have a typo. And I just want to echo what many of the folks have said, and I think I've said myself, is I miss the human interaction with the patients, yes, but more so with the staff. And what I'm going to take with me as we continue through this and into the future, is honoring the work that myself and my staff did prior to COVID to build relationships, to establish our role as a part of the medical team. It has proven leaps and bounds in helpfulness in our being utilized even when we're not physically present. People are still calling upon us to serve the needs of patients, families, and staff. And so I'm going to put that one in the old bag and carry it forward.
Thanks, Lisa. So now I'm going to switch back to gallery view. You guys all stay on speaker view, but this will help me see people. Are there any questions from anybody who's participating here? So one thing that I've been wondering is, how have you guys been relaxing? This is a lot going on, and taking care of yourself is so important. So I'm wondering, how have you guys been doing that?
I'll speak for Susan.
Hi, Joe, by the way. It's nice to see you too.
This has been a very stressful time for a nurse recruiter. She has been through a total roller coaster, from the build up for the surge through the letting go of contract workers and now to the furloughs and everything. There's been no relaxing in her world.
Hey, we went to Utah.
Oh, we did.
We took our kid to Utah in an RV. That was
not exactly relaxing.
Good
I have a
question.
question. Someone mentioned that polio, someone mentioned that this is the first pandemic that any of us have experienced. Was polio considered a pandemic?
Mm-hmm.
I lived through that.
It
Why
was
I asked.
my first pandemic, I'll say that.
And in the way that the public is treated with this pandemic compared to that one is completely different, mostly because we have so much ability to communicate today compared to then. Mostly people just prayed. No one knew what to do about it, except to wait until someone heard it.
Yeah, thank you, Cliff. I agree. I think we've been tremendously blessed with, as much as we can say that there are blessings through this really difficult time, the ability to communicate with one another and to stay in touch. I agree with what was said, that the physical interaction is such an essential part of life, but being able to do this is a miracle.
Jeff, I wanted to just comment real quick about relaxing. In the very first part of this, and somebody else, Doug, I think you mentioned this about being alone. I'm a single person. And so for the first at least month, I was in this apartment, and then with the stay-at-home orders and things like that, I was in this apartment alone for a month, working in my spare time. So for me, relaxing was getting out and walking around my apartment complex and enjoying the view and just the sun on your face and God's creation. I'm also kept company by the hum of the Beltline, which is sometimes very relaxing, but also not. And then finally, I would say, and Susan, I know you're from Human Resources, so plug your ears, but it's pretty awesome to go to work in shorts. And that's been something I've eased into, is that I don't have to wear dress clothes to go to work, and that may be a quick rude awakening to come back to.
Oh yeah, you would see my bare calves if I were to stand up right now. I'm wearing shorts as well, so.
Yeah.
Well, I have a true confession to make. Sometimes when you say relaxing, I've been caught trying to multitask during some of these WebEx meetings. Like, I'll be reading my mail or be reading something, and someone will say, well, what do you think, Colleen? I'm like, could you repeat the question, please? Because I've got papers all around and I'm reading stuff. And but the worst time was I had the camera off and I was in the kitchen baking. And I was trying to sit in on this meeting, and that didn't work out very well.
Yeah.
Well, then a follow-up question, how was the food you were baking? How'd that turn out?
Yeah, I'm a terrible baker, so I thought I'd try and advance my baking skills. So it's kind of coming along, but I just have to accept that I'm not a baker.
Well, no time like the present to learn.
Yeah.
I think too, Jeff,
Yeah.
if I could add, being able to laugh at yourself, because I just found myself laughing both at Susan, but also with myself. That's something that has been enhanced. And yeah, and that's
Yeah.
been relaxing for me, is when I can finally turn something into being able to laugh
Yeah.
at myself.
Yeah, it is a humbling time right now. And if you haven't learned humility, I'd encourage it.
Oh yeah.
Are there any other questions? I think we have some people who either have, I think we have other people on this call who have worked in healthcare in the past. So I'm wondering, is there any thoughts that this has stirred from you? You can unmute yourself if you have any thoughts. If not, then I'll just move on. All right. Oh, Jennifer, you have a question. Yeah, I'm gonna ask to unmute you. You're still muted. There you go.
I am, okay. Actually, it's not a question as much as it is just a big thank you to those of you who are involved in the medical community, because I can only imagine how difficult this has been for all of you and your colleagues. And as someone who required care during this time too, I'm just amazed at the way that was handled due to the delays and everything else. Everything was done really from not just a medical standpoint, but from a human standpoint. And I'm really grateful for all that you do all the time, but especially during this time. It's been wonderful. So thank you.
Thank you.
Yeah, I think this is really a time in which you know, a crisis can either make someone fly or can really make things hard on someone. And so I really give thanks for the medical professionals who, under extreme pressure, have really shown the best of what we can do. And I know that you all work with them, you are them, and so thank you.
Thank you.
Bill, you have a question. I'm going to unmute you here. Go ahead, Bill.
Yeah, it's more of a comment. I have a blood condition where I have to go into UW hospital to be drained of a pint of blood every 2 weeks. And I just want to say that UW hospital is just fantastic. Going through the gauntlet of nurses at the entrance, to getting myself up to the infusion center. It's definitely quiet in there. Oh, that's probably a big. It's very quiet there, but it's been an excellent experience. Just wanted to mention that for all the UW Health people. Thank you.
Well, thank you. And on that note, I just want to say one more huge thank you to everybody who is on the panel. We're really tremendously blessed to have you all in our community, and that we're just, as a church, as Covenant Presbyterian Church, there's no end to my gratitude for you all. This is the last in our series, Working Differently in Different Times. And so a huge thanks to the Adult Education Committee, who has done a tremendous job putting this together, recruiting panelists and brainstorming ideas, and they've done a really wonderful job. A huge thanks to all our panelists today and over the past 3-4 weeks. really, it's been just mind-blowing and fantastic. I've been really honored to be a part of this. In the coming weeks, we are going to have some adult ed that is centered around our upcoming sermon series, but also centered around community. It's the Little Books with Big Impact series. And so for the next few weeks, starting on June 7th at 10:30 is when adult ed is in the next few weeks. I'll say that one more time, 10:30 for the summer. We'll be getting together. There will be some light Bible study on the little book. We're going to try and do some coffee hour stuff. So we're really going to try something new here, do some breakout rooms with some questions and some conversation and just a chance to be connected with one another, and some Bible study on top of that. Charlie's leading it next week, so I don't know if you have anything you want to say about it, but just 2 thumbs up. That's all we need. Let's
If you
see.
want bonus points, start reading the book of James. That's what we're focusing on.
Yep.
Little book, five chapters. Good stuff.
Thank you, Charlie. Yeah, read the book of James. If you start today, you'll be done by probably 1 p.m. So, so there's no time like the present. And so I'm going to close this with a prayer, and then I'm going to stop the recording. But just before we go, one more thing I wanted to share, just as something that we can all keep in our hearts and in our prayers, is Nick Von Bergen was going to be part of this panel as well. And he was not able to be on the panel due to the death of his father, Mick. And so the Von Bergen family is a large group of very dear people. And I encourage you to keep them in your prayers right now as they walk through their grief. So just, I'm missing Nick here, but I also, I just want everybody to know that our prayers are with them. And so I'm going to close this with a prayer. Holy and gracious God, we give thanks for the day that you have made and for the opportunity to learn more from one another. We are stronger when we are together, and even if we are physically apart, we are drawn together when we learn more from one another with one another. We give thanks for medical professionals, for all those who do everything they do to keep the hospitals running, to get nurses to where they need to go, who provide spiritual care and who teach and treat and care for your people. We would be lost without them. We especially give thanks that they've proven themselves resilient and adaptive in the midst of an unprecedented crisis, and that resilience may serve as a reminder of the resilience of all people, that we can, when we come together, do all things. We pray for our communities, for our country, for unrest, but we also pray for oppression and the systems that oppress, that we may find ways to turn those systems around and turn them over, and so we may find justice and peace for all. Amen.
Amen.